You're watching Virginia This Morning.
Well, as families get together over the holiday season, they may notice changes with older family members. Maybe their home looks out of sorts, their own appearance or hygiene is neglected, or they're very forgetful. These are just a few signs that care may be needed. Starting this conversation, though, can be challenging, and then identifying options can really be overwhelming. I recently talked with Senior Connections, the Capital Area Agency on Aging's Executive Director, Thelma Bland Watson, and Care Advantage founder and president, Debbie Johnston, whose experience with her own aging parents inspired her to start her business. Thelma and Debbie share guidance on starting the conversation and exploring options.
So even though we're all very busy with the holiday preparations, we should remember to just take stock of whether or not assistance is needed with such things as transportation. Are older relatives able to get to and from needed doctor's appointments? They may be reluctant to ask for assistance because everyone is busy, especially during the holidays. But, you know, a good suggestion is to make a checklist. Whether or not there's a need to assist with meal preparation, or is there a need for home care assistance, as well as such things as transportation.
What are some of the signs that family members may be seeing when they're connecting over the holidays?
Well, they may notice that there's been a change in the overall health condition of their loved one, or there may be a reluctance to really discuss how they're feeling, or there may be the tendency to not eat, or simply a difference in the appearance of the individual, or the reluctance to answer questions in terms of how one is feeling, and whether or not there's any needs that need to be taken care of.
So when you start to identify some of these things going on and you think, I need to address this, you suggest making that checklist. But how do you get the conversation going with an aging parent or an aging loved one?
Well, I think that we like to suggest that we jumpstart the conversation, that the earlier the better, that as younger relatives are visiting with parents throughout the year, you know, start the conversation and ask the question, what would you like to have done if a certain situation comes about? Or also ask, is there a will that has already been prepared, or suggest that perhaps this would be a way to start the conversation? What would be your wishes? And then to include in the checklist information about resources. And we're suggesting that people would start with community organizations, and Senior Connections and other area agencies on aging throughout the Commonwealth would be great places to start. We also have state level resources. We have the Virginia Department for Aging and Rehabilitative Services, as well as the online resource, Senior Navigator, and then by telephone through our United Way, we have 211 Virginia. That is also a wonderful resource.
Do you find that a lot of people who start this process and make that call to Senior Connections are surprised by what is available?
I think so. I think people don't make that call until they absolutely have to, and so therefore using the holidays as a time to really, you know, start the conversation, look at the checklist of what the needs might be, and then to begin to identify some community resources really is ideal.
How did that personal experience then inspire you to make sure that others had resources available?
It made me realize what it was like to have caregivers in a home, how they impact the individual, how you want it to be a good experience. So we upped our regulations on who we hire. The state requires certain things, and we advanced that because we want to get good caregivers. Really important to get good caregivers that go along with your loved one, and that's a match. We want it to be a good match. So we do everything we can to screen and look for the right person for the right patient. So I advise people with aging parents to start looking at options now. Don't wait till the nanosecond happens and then you have to react. And certainly home care is a really good choice because I think people like to age in their own home. and like their surroundings, like their church, like their friends. So home care makes that happen, where they can age in place and still enjoy all the things they did for years.
For a lot of people, the aging in place and home care is really what they would like to find. A lot of people find stumbling blocks to be able to pay for those things. Sometimes cost can be a really big factor.
There are a number of payment sources, and I don't know that you can put a price on the peace of mind that you get for having a nurse with your loved one.
And for many people, when they start to discover that there is an issue or a need, they may be kind of on the fence thinking it's all or nothing. Is there a spectrum of care?
Yes, we do everything from 2 hours a day. Some people just need a bath or a start in the morning. Some people need 24-hour care. So you can choose 2 hours, 4 hours, 6 hours, 8 hours, 24 hours. Really, you have the choice is yours to how much care you need.
For folks watching who maybe are in that position where the nanosecond has changed, everything's changed in that nanosecond, or for the folks that are planning ahead, but they don't know how to start the process, what are your words of wisdom?
I say start exploring options. If you're thinking about home care, look at credentialing. You know, what kind of credentials does this company do? Ask for references. Ask to meet the employees before they start with your parents. There's a number of ways that you can kind of look around to see how things are going. And social workers in hospital are very good resources. We get tons of referrals from them because their job is to make sure that you're okay when you go home.
Debbie, when folks are just starting out with this and they really are overwhelmed with not knowing where to begin or what's needed, how does that process work?
We have a nurse that will come out and make an assessment of your loved one. They will also talk to the doctor, talk to you, and just try to figure out what the needs are from a physical standpoint, emotional, spiritual, and they do that, and they're very good at observations and connecting with the patient's doctor.
You can learn more about the elder care resources available from Senior Connections, the Capital Area Agency on Aging, by calling toll-free 800-989-2286 or visiting seniorconnections-va.org. Or more about private care from Care Advantage by calling toll-free 800-473-0022 or visiting online careadvantage.com.